Good afternoon and welcome to AARP's Office of Volunteer Engagement Volunteer Tele-Town Hall. My name is Megan Hookey. Thanks so much for joining us. We have a very busy day here in Washington, D.C., as you will hear from one of our guests. So we are going to get to business right away. And I am delighted that today we'll be having a chance to talk first about AARP policy and how it's developed, and most especially the opportunity for our volunteers and others to offer input on key areas of AARP's work related to policy. So let's begin. Our first guest is Christina Fitzpatrick. She is AARP's Policy Development Integration Director, and she joined AARP in 2007, having been a senior policy analyst for the Joint Economic Commission in Congress, and had also worked at the Women's Law Center. One of the things about Christina's work is that she really has to balance her policy expertise with the real personal side of our work, and the fact that we're working with stakeholders who are volunteers to executives of major corporations and other industries that are impacted by AARP policy. So to begin, welcome, Christina. Thank you so much for being here.
Thank you, Megan. I'm really glad to be here.
Good. Now, we haven't had a chance to talk about policy development at AARP through one of these volunteer tele-town halls in a little while. So can you give us a little thumbnail sketch of how does AARP's policy development work in your team?
Sure. So I'm with a team called the Office of Policy Development and Integration. We're part of the Policy Research and International Department, which includes the Public Policy Institute, which many of you might have heard of. And we have a twofold mission. One is to lead the development of public policies at AARP, and then the other is to work with departments throughout the organization to ensure that those policies are integrated into everything that we do. So a big part of that is lobbying and trying to affect public policy. But these policies also guide AARP's activities, our personnel policies, any kinds of interactions we have with members, any kinds of partnerships that we develop, products and services. We want to really walk the talk. And that's what the AARP's public policy and this really careful policy development process is all about.
So we've been in business, AARP that is, has been in existence for 60 years. So over those years, obviously, we've developed lots of policy and statements about particular areas of our world and the United States in effect, in addition. And there's got to be a way to keep track of it. And that typically is done through the AARP policy book.
Yeah.
Can you just give us a glimpse of what that means and how people can tap into it?
Sure. So we have a public policy book, as Megan has mentioned, that is an amalgamation of all the policies that the AARP Board of Directors has ever approved, and that's what shapes our work. And it is divided into 12 different chapters, so from everything from retirement savings, health, livable communities, utilities, taxation, employment. All the issues that are important to AARP and to our constituents are found in that book. And now it's a book that is available online, and we've incorporated a lot of different features into it to make it easier to use, make it easier for people to find what it is they need when they need it. And so people can find it by going to policybooks.aarp.org. And that takes you to the policy book, and you can search, you can browse, and you can see AARP's approach to any issue that you're interested in.
And again, I'm going to repeat that web address because oftentimes there are volunteers who really do wonder, how does AARP decide what areas to work on and what are the guidelines or the boundaries of that? So we do have instances where our policy is something where volunteers want to be able to see it. And so by visiting, as you said, that website, policybook, all one word, policybook.aarp.org, that's one of the best ways for people to get that just-in-time view. Now, and speaking of just-in-time view, you also are looking for input, just-in-time input from real people, not just AARP staff, not necessarily just AARP leadership volunteers, but as many volunteers and members of the public. And tell us about that charge that you've been given from AARP's Board of Directors.
Sure. So in general, we work to update our policies to make sure that they are good and useful for what we need and what the current environment is. And on occasion, we identify a topic that needs much more in-depth work, and so we put a lot of effort and a lot of resources into investigating. So right now, we are looking at something called big health data. And big health data is what's used to refer to the ability to gather and analyze enormous quantities of information about our health, wellness, and lifestyle. And what's different now is it's not just about your medical records and your interactions with your healthcare provider. Now all of that can be combined with your information from your step tracker and your sleep habits, and if you're doing some kind of like online dieting app, or it can also be combined with your search history, with your purchasing history, to create this picture of your health that could be very useful. And it could be useful to medical researchers for identifying new and better ways to diagnose and treat disease, to prevent disease. So it could be very useful to individuals to be able to get a full picture of their health and their activities to be able to improve their health. But there are also, as you might imagine, if you're going to put all this information together, there's also real opportunities for privacy violations, for data breaches. And so our policy exploration here is to understand that tension between how do we enable the good things that could happen while preventing any kinds of abuses. And one really important part of our policy development process all the time is getting input from members, volunteers, and the 50+, because we want to know what people think, what their experiences are, so that our policy is grounded in reality, not just in what your policy wonks in Washington think. So we've developed this survey that we hope that all of you on the call will participate in, and that we hope you'll spread the word about, because the more people that get involved, the better the outcomes will be.
So this is something that could be generational, because I know my children who are in their young 30s are very comfortable sharing information, but there may be others of us that are less comfortable. And I think one of the ways we see some of this data mining is if I do a Google search on, campfires or something, suddenly I get all sorts of ads on the side. So this is the equivalent, but it's related to our health. Mm-hmm. So where do people go to offer their input?
So there is a link in the OVE update that went out a couple days ago, and so you can find it there, or the web address is kind of easy. It's aarp.crowd.law. So aarp.crowd.law, L-A-W.
That's great. And once you go there, you'll actually, this survey, it's a survey with posing questions.
Right.
It's a number of questions. You have an A or a B, you choose one, and it leads you to another set of questions and such. So for those who are interested in offering an input or experiencing this survey, I encourage visit aarp.org, It's
aarp.crowd.law.
Sorry.
Or go to Megan's excellent OVE update, and you'll find a link there.
As excellent as it is, I know not everybody on this call gets it.
Oh.
So aarp.crowd.law. So that'll be great. And again, that's a way for all of our volunteers and other members of the public to offer input onto that. So we're in a window right now where you clearly want to know about big health data, and that's what the nature of this survey is and the questions that will be asked. But what if somebody goes to the policy book and says, gosh, there's information on pensions. I want to know a little more. I have a suggestion for that. How would they offer input there?
We have a very easy-to-remember email address, and we check it every day, and it's policy@aarp.org. And so everything that comes into that address, we keep track of, and periodically when we are examining the policy book and trying to figure out what kinds of changes we might need to make, we use all that information. So I really encourage you to use that email early and often and pass it along to anybody that you know who would want to let AARP know what they think.
And I think that's so important for our volunteers to know that AARP's policy is shaped and informed by the input we receive from those who care about these issues, who are 50+, not only members but non-members as well. So we've given a number of email addresses that I'm going to just review. If you'd like to see AARP's overall policy and just want to look and browse by topic, visit the policy book, and you'd find that at policybook.aarp.org. If you'd like to participate in this survey, on big health data. And again, we very much want to encourage people to do that. We have till about year end, roughly, to be able to capture people's input. And you can log on to aarp.crowd, CROWD.law, LAW. That takes you right to the site that offers this input opportunity for big health data. Anything else that we want to share in these final remaining moments, Christina?
I just want to reiterate that volunteers serve a really important part of our policy development process. We have this thing called the Volunteer Advisory Committee that is 8 volunteers from across the country who provide guidance and advice to staff. And so that's one important way that volunteers are involved. And then having all of you spread the word about opportunities like this is really, really important for making sure that we are getting the voices from the states into the policy that we're developing.
So this is our opportunity when we want to say we have input on the decisions that AARP makes through our policy. That is definitely a way to do it. So Christina, thank you so much for being here, and I hope our listeners will take full advantage of what you've heard today and pass the word along to others so that they too can offer input. Yeah. Christina, thanks so much.
Thank you, Megan. Have a good day, everybody.
So we're going to shift gears because this is a busy day in Washington, and we have snagged Bill Sweeney, who's AARP's Senior Vice President of Government Affairs. And you may have joined us on a prior call several months ago when Bill had just joined AARP this past July, and you will know that he brings a deep Capitol Hill experience, having recently served as the staff director for the Senate Democratic Policy and Communications Committee, and he also had a number of roles for U.S. Senator Debbie Stabenow, including being her chief of staff. Today is an incredibly busy day if you're tracking H.R. 3, as Bill is doing while we're talking, and he may have to leave. So if he does, please know that we recognize that he's going to where he needs to be. But right now he's with us. So Bill, thank you very much.
Welcome.
What can you tell us about H.R. 3, the prescription drug bill?
So the House just passed the bill, which is fantastic, and it was a bipartisan vote, which we weren't fully anticipating. So we're extremely thrilled that 2 Republicans joined 228 Democrats in voting yes on that bill. And so this is a really big deal for AARP. We have been pushing really hard for this bill, and we're glad that it is now a bipartisan bill. H.R. 3 is the Elijah E. Cummings Lower Drug Costs Now Act, and it does a couple of big things that we're really proud of. The first is it would allow Medicare to negotiate for the price of prescription drugs. This is a huge issue, and the Congressional Budget Office, which is nonpartisan, scored that provision, which means that they studied the provision and found that allowing Medicare to negotiate with drug companies would save taxpayers $345 billion. That's with a B, $billion. Overall, the changes in H.R. 3 would actually save taxpayers $500 billion. That is a tremendous amount of money. What the authors of the bill did with those savings, which we're also thrilled by, was to reinvest them into Medicare. So the bill would create a new dental benefit, a new vision benefit, a new hearing benefit in Medicare with those savings that are realized from lowering prescription drug costs. In addition, it plows $10 billion back into the National Institutes of Health to continue work on finding groundbreaking cures and treatments. You know, the reality is that the National Institutes of Health does a lot of the basic research that goes into the development of new prescription drugs, and so taxpayers have already paid for a lot of the research and development in prescription drugs. And we also know that 9 out of 10 of the biggest prescription drug companies actually spend more money on advertising than they do on research and development. So it's a really important thing that that this bill included additional funding for the NIH. In addition, the bill would cap out-of-pocket costs for seniors to $2,000 per year, and then there's a smoothing where I'm doing air quotes, but smoothing means that it allows an individual senior to stagger out that $2,000 over the course of a year so that they'll never, the idea being you would never pay more than that. So those are all really great provisions. There's a ton of provisions in the bill. I can't go through all of them, but they are, the bill really is a very strong bill and has really everything that AARP has been advocating for. It was really important to us here at AARP that we get a really strong vote on H.R. 3, and I'm so glad that we did, and so glad that it was bipartisan, because what we know needs to happen next is that the Senate needs to take up bipartisan legislation that passed through the Senate Finance Committee this summer that would also lower prescription drug prices. That bill is called the Grassley-Wyden bill. It is bipartisan. Senator Grassley, the Republican chairman of the Finance Committee in the Senate from Iowa. Ron Wyden is a Democratic ranking member on the Finance Committee from Oregon. The two of them have worked on this bill together. It does not have negotiation, so it doesn't get all those savings that the House bill does, but it does have an out-of-pocket cap for seniors, and it also has an inflation cap. So if prescription drug companies raise the price of a drug over faster than the rate of inflation, it caps that and stops them from being able to do that, which really keeps a lid on the rising costs of prescription drugs. So those two provisions particularly, there are a number of others, but those two particularly we think are real game changers for prescription drugs and would lower the prices for everybody.
So how do we move forward? And I know we probably only have you for a moment longer because literally Bill needs to start fielding phone calls from the press and others.
Yeah.
But we've passed it in the House, bipartisan, hooray, thank you volunteers, you were a big part of that. The Grassley-Wyden bill is in the Senate, so they'll come together in conference. Is that the next step or something else?
No, so what this really does is it puts pressure on the Senate to get something done. What the Senate will then do, in the perfect world, which we're not there yet, but in a perfect world, the Senate will make probably some changes to their package to get more people on board, and then what we'd like to see that do is to become part of a larger legislative package that would do some additional work on these. This is all very technical and complicated, but things called fish payments. I forget what it stands for, but it relates to payments to hospitals who don't get who have a lot of uncompensated care. So people without health coverage who go to the hospital for urgent needs. Those hospitals get a dish payment from the federal government to help make up the
subsidized.
Exactly.
Sure.
And so there's that, plus a number of other, they're called health extenders. Those cost money, and the savings from the Grassley-Wyden bill would be used to pay for those additional Medicaid. It's mostly Medicaid funding. So it's a very technical package, which we are looking at when that can go. But hopefully that could all package together sometime early in the new year.
So nothing really likely in this calendar year.
No, Congress only has 5 more days that they're in session, and frankly, they have a very long list of things that they need to get done in the next 5 days. It's not clear that they will even do those things, and so we do know that prescription drugs is almost certainly not on the dance card for right now. I will also add that the politics around impeachment make this a little bit more complicated.
And that was a question that we had been given from one of our volunteers. Are we able to proceed with our work in this environment?
So, it's interesting. I mentioned this to a few volunteers earlier this week who I was talking to. On Tuesday, the days are all getting mixed together here, running together, but on Tuesday, the Speaker of the House did a press conference where she announced the articles of impeachment, and then immediately did another press conference where she announced that she was supportive of the president's signature trade deal, the USMCA, or some people call it NAFTA 2.0,
right.
Which, by the way, included a big win for AARP. They dropped a whole provision out of that bill that was a real big giveaway to big pharma companies. Speaker Pelosi and President Trump both agreed to pull that out, and so we're very pleased that bill isn't another big giveaway to pharma. So it's weird because there is still bipartisan stuff happening, even though the news media makes it sound like everything is really bad. And look, it is bad from a partisan perspective, but even in rough weather, people can still find time to come together on things that they agree with. So I think it's a little unusual. I think these are strange times we live in, and I do think it's possible that we can get something done. Now, in terms of the timing, what we know from Republicans in the Senate, Senator McConnell is holding the month of January for the Senate to do its duty under the Constitution of having a trial, an impeachment trial. And that is a whole thing, which sometime I'd love to walk people through, but the Chief Justice of the Supreme Court presides over the Senate. The senators have to sit in their chairs and not speak for the whole period of the trial, which for senators can be challenging. So there's a whole set of procedures and special rules that come into effect. So while that's happening, perhaps behind the scenes there will be some negotiations around these health extenders and hopefully a prescription drug package, as well as perhaps a few other things that we're working on.
Sure. Well, obviously, busy times. I know that we're probably going to have to go. Don't think you can take any questions right now.
I can take a few questions.
So if you want he's watching his phone.
I'm sorry, I'm watching my email just to make sure.
So if you would have a question for Bill Sweeney, right away press *3 on your phone, and that way you can ask a question of Bill Sweeney, our Senior Vice President of Government Affairs. We're doing it with the full forewarning that this is a very exciting day in Washington. It's a great day for AARP and our members and volunteers and their friends and family because H.R. 3 has passed on a bipartisan basis, and that was a signature piece of legislation that was really what our Stop RX Greed campaign has been connected to. And I know, as does Bill and all of our colleagues, that volunteers have really made the difference. So if you would like to ask a question of Bill in these few more moments that we have, press *3 on your phone. But Bill, I know we have a couple other things. We had a good win last week, I believe, around robocalls, and that impacts our members as well.
That sure does, and it impacts all of us. I got 2 robocalls yesterday. They're so annoying, and not only are they annoying, but honestly, they're almost always these illegal robocalls are trying to defraud people. These are scammers on the other end of the line trying to get people to believe that that Social Security is calling them or the IRS is calling them or something. And so not only are these robocalls annoying, but they're really dangerous, especially for older Americans. The House passed the Stop Illegal Robocalls bill that they're calling the Traced Act. They passed that last week on a very, very strong vote. Just 3 people voted no.
So again, very bipartisan. So this is great. Again, in this odd days and times that we're in, we feel like we're in gridlock, and the right side of the aisle and the left side of the aisle can't seem to work together. There are some glimmers of hope.
There are, and so the next step on that one is the Senate. We're not really sure. The rules of the Senate are such that any one senator can hold things up, sometimes over unrelated matters. We believe that there may be at least 1 or 2 of those holds on the robocalls bill. I don't think they're really substantive about the bill. I know that the senator from West Virginia is putting a hold on everything until the miners' pension issue gets fixed. It's really important for coal miners in West Virginia, Kentucky, Pennsylvania, and a few other states. We believe that the senator from Kentucky, Senator Paul, has some other hold on the bill, which we're trying to resolve right now. So as we work to figure out what's going on in the Senate, but we'll definitely, if there's a call to action, we'll let folks know. But we think right now this is just the normal process of the Senate, and we do hope that it can get cleared soon and get it passed into law.
That's important. Again, if you'd like to be part of the conversation, press *3 on your telephone keypad, and that way you can be connected to one of my colleagues to help make sure we get you in our queue for as long as we have Bill Sweeney. Bill referenced the robocall bipartisan passage of that Traced Act. If you'd like to know more about that, we have posted some background information. In fact, AARP's letter of support, it's on the volunteer portal, and you can look under TRACED, and you'll find that as well. One other area we know that we have is the medical expense deduction. That seems to be something that has had a flurry of activity. It doesn't always get the headlines. Anything that we should know about that?
Well, that's really important, and this is really one of our biggest issues right now that we're trying to get Congress to focus on. With so much going on, it is hard to get Congress to focus on issues that aren't directly in front of them. The medical expense deduction is a tax provision that for years has made it so that people are allowed to deduct their high medical expenses that exceed 7.5% of their income. Based on very obscure reasons, it went up to 10 at the beginning of this year, 10%, and we're working to get that back down to 7.5, where it has been for years. This is really just kind of caught in congressional inertia. There's a whole package of other tax provisions. It's called tax extenders. I mentioned health extenders earlier. And a lot of those are related to energy. There's some energy, oil and gas company tax provisions. There's some clean energy tax provisions that the Democrats like. There's some provisions in there for small breweries, all kinds of things that lots of people like. And really, the medical expense deduction is the one that's stuck in that, which is for families, not for businesses.
Okay.
And businesses have the ability to they have accountants, they have accounting firms, they can go and do what's called a look back, and they can claim these tax credits that get done retroactively years afterwards. But families who have high medical expenses, these are very high medical expenses. 4.4 million families would be impacted by a tax increase if Congress doesn't get this done. We're trying to make Congress realize that families don't have accountants that are going to go back and do this. The money they would spend on the accountants would be more than they would get in the tax return. And so making sure that they understand, do you really want to go home for Christmas having raised taxes on 4.4 million Americans with high health care costs? So trying to get this to the top of their radar screens, and we're working really hard to do that right now.
Well, it's important. It's a complex issue, but one that does impact people. I have one question, if we can take your time. We're going to go to Indiana and welcome Ronaldo. Hi, Ronaldo. Thanks so much for waiting. Could you share your question or comment for Bill Sweeney?
Yes, please. The cost savings that could be accomplished if HR goes through and becomes law, it seems to me that some or maybe even all of those savings should be directed toward preserving Medicare as a program, because the program is, in fact, in jeopardy on a shorter timeline than even Social Security. So, what would be the point of increasing benefits if we can't extend the life of the program?
Well, Ronaldo, thank you very much. Bill, comments? I know you said that the savings was going to go into vision, hearing, dental areas that older adults do need and haven't been able to get through Medicare. Well, what's your thought about using it to preserve or protect the program?
I think this is a great point, and I don't know exactly how many years it would have extended the trust fund. I don't think I've seen the trustees report from Medicare yet, but we certainly do know that one of the main drivers of costs in Medicare is prescription drug prices. In fact, Medicare premiums went up this year, and the White House, when they made that announcement, pointed to the fact that the reason that those premiums were going up faster than the inflation was actually because of those high prescription drug costs. So it certainly is a critical issue, and we will definitely we'll go and look into that.
And does it feel like we have support from the administration to help really fight the prescription drug? I'm reading some conflicting headlines.
Yeah, I think so. They did come out and oppose the bill in the House, H.R. 3, which we didn't think was terribly surprising. We think that was kind of a political move. rather than a substantive policy move. But they have put out statements of support for the Grassley-Wyden bill in the Senate, and so we do hope that everybody can work together, that Democrats, Republicans in the House, the Senate, and the White House can all work together to get this done. This is so important for Americans. It's the number one issue that we hear about all the time, and so we just need to make sure Congress and the White House understand this just needs to get done.
Well, that's one of the things that's great about what AARP can do. We can, not lose focus. We stay on these issues whether they want us to or not, and our volunteers help us do that. Do you have time for one more?
One more.
Okay, this is our final call, but this time we're going to go to Kathy in Florida. Kathy, thanks so much for calling in. What's your question or comment for Bill Sweeney?
Just a quick question. You mentioned the robocalls calls. I just want to know, is that subject being discussed while seniors are in attendance for a class such as, whether it be driver safety class or any other type of class? Because it's harder to get people in there to come back to attend a separate class, informative class. It's easier usually when you can catch them while they're already in attendance. And I know a lot of seniors have really fallen, to these calls and have lost a lot of money from their, life savings. So I just want to know if that's something they're being told about while they're already in attendance for another class, so that, you can inform them while they're there versus coming back at a later date. Due to scheduling issues, a lot of times it's hard to get people to come back for another session.
Thank you, Kathy. I think she raises the point of when we're with volunteers or members of the public, like a driver safety class, is that an opportunity for education? Mm-hmm. And I think we're seeing that with our fraud work. Mm-hmm. And, the best piece of advice you can give someone is if you don't recognize the phone number, don't pick up the phone and answer it. Mm-hmm. I don't know whether you have ever heard of any training or educational outreach that might be part of this work for fighting robocalls.
That's a great idea, and I think certainly as we're working on a large effort right now between the work in the programs department, where we do the Fraud Watch Network, and it's teamed up with government affairs in the states, and we're working on building out our fraud advocacy. I met with a state office on Tuesday of this week, and that was one of the things we talked about was in some of those events that states do. For example, the big shred parties, mm-hmm. where we're working on getting everybody to shred their mail with their personal information in it to stop fraud, is to make sure that we're tying that together with our other fraud advocacy work that we're doing, so folks know how if they want to get involved in helping to fight fraud, what are the things that they can do. So we're working on that, and that's a great suggestion that I'll take back to my team and see if we can try to do more of that.
Well, thank you. Bill, I know you have to run. I appreciate you being here, giving up this time on a very, very busy day. Yes. And volunteers, staying on the line, we're going to just talk for a moment longer, but we truly appreciate you being here.
And I do want to just say thank you to all of our volunteers. You helped make this happen. You've been making phone calls. You've been showing up at offices. You've been circulating petitions and tons of other work. Some people have been dressing up as Tyrannosaurus rexes or RX T-rexes. I just really want to thank all of you. You helped make this happen, and you're continuing to be you're the real secret sauce in our work right now. So thank you so much for everything you do.
Well, that's great. Thank you, Bill. And I know you've seen it from the side up on the hill. So we want to invite all of you back to another call. We have the opportunity to have Nancy Lamont, who leads AARP's Community, State, and National Affairs team, and her colleague, Kristen Dillon, who leads the States and Community Engagement team. That means basically all of the state offices. They're going to join us next Wednesday. That's Wednesday, December 18th at 1 o'clock p.m. Eastern Time. So a little bit different time. But it's the reason why they have wanted to come together and chat with as many of our volunteers as possible is that we have been given an opportunity by our CEO to think expansively, to have blue sky thinking, to brainstorm different ways that we could expand AARP's reach with our materials and our messages and tools. If we were able to find different ways to engage other volunteers. You all have been so incredibly generous with your time, and we want to honor that, and you can count on us continuing to support that. But we also want to tap into ideas for what else could we be doing. Obviously, we need to keep it in the family of the AARP body of work, but are there different ways to connect with people? And are there different roles that we could take on? Perhaps using something that's more virtual-based and volunteers who work from home, so to speak, and sharing information. So I would like to invite you to think about that, to think about the fact that AARP would like to have more reach and impact to help more people 50-plus and their families with the resources and materials that we have, so many of the things that I know you're connected to. How could we be even better at connecting with people? And we're going to have a conversation. Again, it's next Wednesday, December 18th at 1 p.m. Eastern Time. And there to both set up the conversation, but most especially to listen to your ideas and comments is Nancy Lamond and Kristen Dillon. So I hope you'll put that on your calendar. We're slipping one more conversation in before year end. And I do hope that you'll be able to join us and know that we very much would look forward to hearing your ideas, and that the phone line, when you are asked to press *3, you'll not hesitate at all. Every idea is welcome. We want to think big. We want to think bold. We'll deal with the details later, but right now we want to build that big portfolio of ideas. So again, please be on the lookout for Wednesday, December 18th at 1 p.m. You'll probably get another reminder notice, but it's the exact same number that you've used today to help join into that conversation. With that, I want to thank you all very much. I know it's a busy time of year, and I appreciate you taking time to be part of today's conversation where we looked at the policy input process at AARP, the opportunity that you and your friends and neighbors have to offer comments on big health data. As a reminder, to take that survey for your input, visit this website, aarp.crowd.law, aarp.crowd.law. That is the website where we're gathering input through a survey, and it's a set of questions about big health data. And that will help shape and inform AARP's policy going forward, making sure that we bear in mind your concerns, interests, opportunities that you see as personal information is collected and often used for good, and often sometimes it could go astray. So we want to make sure we have the benefit of your insights. We also hope that you will keep reading and looking for more information about what's next with prescription drugs. Again, you heard Bill Sweeney say this is a great day for AARP. We're delighted that H.R. 3 passed in the House on a bipartisan basis. And so we look forward to having more information about what will take place in that prescription drug effort, especially as we go into 2020. And with that, I thank you all very much for being part of today's conversation. We've got a recording, and you'll be able to see it on the volunteer portal, along with a range of resources for materials that we talked about today. I hope you have a great day, and look forward to seeing you next Wednesday at 1 p.m. Eastern Time. Thanks so much. Bye-bye.